So we know that the real life scenarios are very different from the clinical trials. So the aim of this paper was to assess in a real world clinical activity if the nodal dissection after a positive sentinel lymph node biopsy really play a role in preventing the risk of relapse, and if this clinical surgical activity does have an impact on the overall survival. So we used an inverse probability treatment weighting method to control for several baseline features. And so we were able to assess the role of nodal dissection and adjuvant therapy on this cohort of patient. And again, our findings confirm that adjuvant therapy is the big game changer in these patients, and not the nodal dissection as we used to think back then before adjuvant therapy.